Sugary beverages, including sodas, sweetened fruit juices, energy drinks, and even sweetened teas and coffees, are among the most harmful consumables for individuals living with diabetes. These drinks contain high concentrations of simple sugar such as glucose, sucrose, and high fructose corn syrup, which are rapidly absorbed in the gastrointestinal tract, leading to immediate and pronounced spikes in blood glucose levels. This hyperglycemic response triggers a compensatory surge in insulin secretion, which over time places significant stress on pancreatic beta cells. Chronic overproduction of insulin in response to frequent sugar intake can accelerate beta cell dysfunction, a hallmark in the progression from insulin resistance to type 2 diabetes, and may exacerbate disease severity. Beyond the acute effects on glucose and insulin dynamics, sugary beverages contribute significantly to overall caloric intake without providing satiety, promoting weight gain and visceral adiposity. Visceral fat is metabolically active and strongly associated with increased insulin resistance, chronic inflammation, and elevated cardiovascular risk, all critical factors for patients with diabetes. Longitudinal studies have demonstrated that individuals who regularly consume sugar-sweetened beverages have a substantially higher risk of developing type 2 diabetes, independent of body mass index, underscoring the direct metabolic consequences of these drinks. Moreover, frequent consumption of these beverages is linked to dyslipidemia, particularly elevated triglycerides and low high-density lipoprotein, HDL, cholesterol, which compounds the risk of atherosclerotic cardiovascular disease, a leading cause of mortality in diabetic populations. Evidence also indicates that high fructose sugars can contribute to non-alcoholic fatty liver disease by promoting hepatic lipogenesis, thereby further impairing glucose metabolism and increasing insulin resistance. It is important to note that artificially sweetened beverages are not necessarily safe alternatives. Emerging research suggests that artificial sweeteners may alter gut microbiota composition, influence glucose homeostasis, and induce compensatory increases in appetite and sugar cravings. These effects, while subtle, can undermine glycemic control and indirectly promote behaviors that exacerbate diabetes. For individuals managing diabetes, regular intake of sugary beverages represents a persistent and potent threat to metabolic stability. The physiological consequences are cumulative. Each episode of rapid glucose and insulin fluctuation stresses endocrine and cardiovascular systems, contributes to fat accumulation, and can accelerate complications such as nephropathy, neuropathy, and retinopathy. From a research perspective, these findings highlight the importance of including beverage consumption patterns in dietary interventions, epidemiological studies, and clinical guidelines aimed at diabetes prevention and management. Avoiding sugary beverages entirely is not merely a recommendation. It is a critical intervention to maintain metabolic homeostasis, preserve pancreatic function, and reduce long-term morbidity and mortality.